Hey, this is Dr. Angela. Welcome to a brief episode of the Lifestyle MD. I'm experimenting with something new this year, and that's providing some short episodes just to provide some brief insights to keep the conversation going. So, the topic today that really struck me was the question I get about GLP-1s. I'm always um, having conversations with people regarding the use of GLP-1s, specifically for weight loss. And the the question that comes up is, what do you think about it? Is it safe? Is it a good idea? And I will tell you, generally speaking, they're very effective. Is it a good idea? Not so straightforward. It can be. But here's the caveat. As far everything that we know about it now, I mean, our knowledge about these medications and really any medication, just period, is limited by the how long it's been in use and by how many people use it. So we do know right now that people who use the medications for weight loss, they essentially have to use it forever in order to sustain the weight loss that they achieve. In order to keep that going, you are going to have to take it indefinitely. So what does that mean? If you are trying to get a quote jump start on weight loss, it's not going to be the right choice for you because as soon as you discontinue the medication, the weight will come back. So I discourage utilizing this medication if your intention is, hey, I need a jump start, because this is not a jump start kind of medication. If you're someone who is opposed to taking a medication, a pharmaceutical long term, this is not the medication choice for you. If you are someone who is not going to, or is unwilling to, or for some reason unable to embark on lifestyle modifications that will make not only the weight loss sustainable and effective and healthy, such as adding in cardiovascular exercise, resistance training, and changing your diet to support adequate protein intake and eating whole foods, I would discourage you from considering the medication also. Now, who is it a good idea for? This is where I feel my approach is becoming maybe a little bit more mainstream. I'm hearing more conversations around it. Someone who has multiple chronic conditions or other ailments that may benefit from the medication, and conditions that are not going to go away. Lifelong conditions where having some long-term treatment, and thus far we don't know of any other way of improving those symptoms, this may be a great option for you. So some examples, chronic colitis or an inflammatory type disease of the bowels. I'm reluctant to say inflammatory bowel disease, Crohn's, and ulcerative colitis. I can't say that there's been enough evidence to support that. I certainly haven't used it in those cases, but I have used it for patients with various other forms of colitis, and they have had sustainable remission of their symptoms, more regular stools, ability to leave their house, that sort of thing. It's been beneficial and actually helping not only reduce food, like food seeking behavior, like, people who, what I'm thinking, like binge eating, right? So like people will have addictions not only to alcohol and drugs, but have addictions to food. So it not only does it help suppress food addiction, it also suppresses other addictive behavior. So it has some effects on the gut-brain axes, if you will. I think the full mechanism behind that is not really well understood just yet, but patients who struggle with alcohol abuse and misuse, in addition to maybe also wanting to lose weight, patients who are struggling with some sort of drug dependence, misuse and abuse also helps with that. Patients who are struggling with chronic pain. So what you're hearing here is, what I'm noticing is just patterns where inflammation is a threat. So I'll go so far as to say is if you have a condition where inflammation is like causing you problems just across the board, it may be worth considering, at least even trying it. So I've got a patient with who has MCAS, a couple of patients actually with MCAS-like symptoms, and there's also kind of like some overlap, a trifecta of conditions that like POTS that kind of like fit in this spectrum. And guess what? Medication helps them too. So the risk. we don't necessarily know what the long-term effects of it are, right? Of taking a GLP-1 chronically and indefinitely. You do know that you can have an excessive loss of muscle over time. Anyone who loses weight is going to lose muscle and weight. You can't avoid that. It's just a part of the whole process. But how much muscle you lose relative to fat, or I meant to say you lose muscle and fat, how much muscle you lose relative to fat will be impacted by what you're eating and then whether or not you're engaging in regular exercise, strength training, and cardio, as I mentioned earlier. So if you aren't doing those, if you're not doing things to actively build your muscle and engaging in resistance training on a regular, you're going to have an excessive loss of muscle, which is going to long-term be perhaps worse for you than it's not going to outweigh the benefits, or it's going to outweigh the benefits is what I should say. We know that muscle loss is going to happen naturally over time. And if you're losing muscle in excess as you're getting older, you're going to have increased risk for falls. There's some suggestion that even like decreased muscle mass has an association with Alzheimer's and dementia. It's probably because you're not exercising, and that's the kind of like the correlate there. But in any case, it's not a straightforward answer. And so like all of this to say, if you're trying to pick my brain or anyone else's brain about whether or not a medication like a GLP-1 or GIP-1, GLP-1 is a good choice for you, it's not a simple conversation. You're going to really benefit from having a detailed, in-depth conversation with your primary care doctor, whom you hopefully have a relationship with, who hopefully can go in depth with you about the risk and the benefits across the spectrum of all the things you're dealing with. And so it could be a good fit, and it may be a bad fit, and it may be a little bit more nuanced and in a gray area. And those of you who have known me as a patient, or maybe a listener, a longtime listener, you know that I don't necessarily lean into a medication first approach. I don't. I do lean into a lifestyle, preventative, like what are the other levers that we could pull approach. But I've just seen over the course of the last several years that there have been some patients who have had lifelong struggles with conditions that are difficult to manage, and then developed over years that aren't going to be reversed with lifestyle modification, at least not easily at first, if at all. And some of them have done really, really well. So anyway, that is my long-winded, roundabout, indirect answer to whether or not a GLP-1 is a good idea. I hope you found it at least somewhat helpful. If you want to have more conversations about it, if you have any questions you want me to elaborate on that on this topic on this podcast, I'd be happy to do so. You can email us at info@angelalifestylemd.com. And yeah, tune in next time for either our next full podcast episode or for one of our brief coffee breaks.